Did you know your menstrual cycle has 4 distinct phases? Let's chat about it. I'm Dr. Liza, fertility-focused naturopathic doctor, and these are the 4 phases of your menstrual cycle. The first phase is menstruation, or the active bleeding. This starts on cycle day 1, which is your first day of full flow, and continues until that period is finished. After menstruation, we move into the follicular phase, and the follicular phase lasts all the way up until ovulation. Ovulation is the midpoint of our cycle. If you have a 28-day cycle, this would be cycle day 14, and ovulation is the purpose of our cycle. Understanding when we ovulate and determining our fertile window is essential, especially if we're trying to conceive, and we can do this using things like ovulation predictor kits or LH strips, cycle tracking apps, basal body temperature, and physical signs and symptoms like fertile cervical mucus, which we describe as egg white. After ovulation, we move into the luteal phase, and this is when implantation would be occurring if you had tried to conceive. It's also when we experience premenstrual symptoms, specifically in that week before our next period. During the luteal phase, we want to be avoiding anything that's overtly contraindicated in pregnancy if we're trying to conceive, such as excessive alcohol intake. And we want to be focusing on nourishing foods, nourishing movement, and nourishing practices to support our body as we move back towards menstruation.